Hey guys, this is Jay Patel from MyFitMed. Today we'll talk about what minerals a diabetic patient should be taking. So every diabetic patient should be taking zinc, magnesium, selenium and chromium. Zinc has shown to enhance the transport of blood glucose from bloodstream into the cell, thus improving the fasting blood glucose level. Zinc has shown to overall improve the blood glucose level and also cholesterol level in diabetic and non-diabetic patients. Chromium ion are shown to improve or regulate insulin by improving the sensitivity of insulin receptors. Chromium also enhances the transport of blood glucose into the cell, thus lowering your fasting blood glucose level and also postprandial blood glucose level, which is after you eat. The third one is magnesium. Intracellular magnesium plays a key role in regulating insulin action, and it also regulates insulin mediated glucose uptake. Depletion of intracellular magnesium can lead to worsening of insulin resistance in diabetic patients. And the last one is selenium. Selenium is very tricky mineral. When taken in a higher dose, it can stimulate more glucagon production, which may increase your blood glucose level. But selenium, when taken in the right amount, has shown to improve and prevent the metabolic diseases like diabetes, cholesterol, hypertension. It does it by lowering the oxidative stress because it's one of the strong antioxidants. Here at MyFitMed, we do IV therapy for a lot of minerals, vitamins and amino acids to not only improve your blood sugar level but also your overall health. Give us a thumbs up and subscribe for more videos.